Looking at the COVID-19 pandemic, as cases surge in some parts of the country, researchers are studying signs and symptoms of what's known as long COVID. That's where a person experiences lasting effects of the virus or continues to test positive months after they were infected.
Team 12's Rachel Cole spoke to one Valley man who is now part of a national study of Americans who can't shake off the symptoms, even after heeding all the medical recommendations and precautions.
A walk through Costco was a real adventure. And so I thought, what the heck's going on? And it got so bad, I took myself to emergency. And the only thing that was wrong was I had COVID again.
Steve Schumacher rolling up his sleeve for the first wave of vaccines back in spring 2021.
I was within the first maybe 10,000 in Phoenix that got the second one, got the booster. And even with all that, I got it in January and then again in March and then now.
Prior to 3 positive cases of COVID just this year, the 70-year-old led an active lifestyle, running marathons and making fitness a part of his everyday routine. But that's changed.
Taken a tour with some colleagues of mine of the state capitol building, and the tour guide had us go up two small flights of stairs, and I was winded after 2 little flights of stairs. I had to put my hand against the wall.
Since this past spring, Steve has been one of roughly 400,000 volunteering for a nationally funded study known as Recover through the National Institute of Health. The $470 million study focuses on long COVID and why some people, even those who are vaccinated and boosted, aren't catching a break.
I had my lungs checked. I saw a cardiologist, all kinds of stress tests. And they said, well, we don't find anything. It's just this COVID, the symptoms, the after effects. So I thought, I can't be the only one. There's other people who are stressed out and anxious and wondering, and they're not getting answers from physicians because it's new to physicians as well.
He hopes the collection of clinical data, lab testing, and analysis of patients in different phases will begin to show patterns that'll provide answers to participants like Steve over the next few years.
I'm a case, and if people can get value from it and I help figure out an answer, then that feels really good to me. But I'm getting a little bit of diagnosis of my own situation as well as contributing, I hope, to the overall good that hopefully will come out of this study.
Rachel Cole, 12 News.